The following segment is sponsored by Northern Nevada Health System.
March is Colorectal Cancer Awareness Month, and we're here at Northern Nevada Medical Center with Dr. Jane Ohde to talk a little bit about the warning signs and symptoms. And what are the symptoms of colorectal cancer?
Well, oftentimes the symptoms for colorectal cancer don't show up until later in the disease process. Things like black or bloody stools, change in bowel habits, unintended weight loss, those can be signs, but oftentimes there's no signs or symptoms at all.
So you really want to catch this before those signs and symptoms develop, because as you said, oftentimes there's not signs or symptoms. So what can you do to catch it before it gets serious?
So there's a lot of different options for screening, and the most important thing is getting screened in some way. So there's things like stool tests that can test for blood in the stools or abnormal DNA, and colonoscopies.
Okay, and the recommendations on colonoscopies have recently changed, so that's an important reminder maybe for anybody that doesn't see their doctor a lot.
Yeah, you may remember that, over the years it's been the age of 50, but in the last couple of years that's changed to 45 because we're seeing these cancers in younger people.
What is a stool test?
So there's two different types. One tests for blood in the stool, which can have a lot of different causes, and the other one tests for abnormal DNA, which can be a sign of either colon polyps or colon cancer.
Could you talk a little bit about what it's like getting a colonoscopy?
Yeah, so the colonoscopy is done as a same-day procedure. It's pretty quick. The biggest part is cleaning out your colon before the procedure, and then the doctor will look throughout the entire colon and take out any polyps or anything unusual that they find.
And when we talk about patients, who would you say is most at risk for developing colorectal cancer?
So we know that people as they age are more at risk, so anyone over the age of 45 should be screened. People who are at particular risk is anybody that has a family history of colon cancer, has any sort of genetic cancer syndromes in their family. And then, of course, anybody that has symptoms.
So if you feel like you are having a symptom, or if you have questions about this, when should you see your doctor? When's the best time?
I would say as soon as you notice a symptom, it's important to go see your doctor so you can get that checked out. So it's not necessarily to catch a cancer that's already there, it's to catch it before you develop a cancer. So we can identify polyps and remove them before they progress to cancer in the long term.
Dr. Jane Ohde, thank you so much for your time today. If you have any questions, you can watch this back on our website. That's foxreno.com.